Want to score over 850 in your Hesi Fundamentals exam? Then let's get started. Click that subscribe button and join us every Friday. A client is receiving enteral feedings through a nasogastric tube. The nurse assesses the client for potential complications, including which of the following: increased bowel sounds, nasal congestion, frequent coughing, elevated temperature. Pause the video and select your answer. The correct answer is B, nasal congestion. Nasal congestion may occur as a potential complication of nasogastric tube placement. It can result from irritation to the nasal mucosa. The incorrect options are A, bowel sounds are not directly related to nasogastric tube complication. C, coughing is not a common complication of nasogastric tube placement. D. Elevated temperature is not typically associated with nasogastric tube complications but may indicate infection. A nurse is assessing a client with urinary catheter. The nurse notes cloudy urine in the drainage bag. What is the nurse's initial action? Encourage increased fluid intake, change the catheter immediately, obtain a urine culture and sensitivity, administer an antibiotic. Pause the video and select your answer. The correct answer is C. Obtain a urine culture and sensitivity. Cloudy urine in a client with a urinary catheter may indicate infection. The initial action is to obtain a urine culture and sensitivity for appropriate treatment. The incorrect options are A. While hydration is important, cloudy urine may indicate infection, and obtaining a culture is a priority. B. Changing the catheter is not the initial action for cloudy urine. Assessing for infection is necessary. D. Administering an antibiotic should be based on the results of the urine culture and sensitivity. A nurse is caring for a client with a chest tube. What is the primary purpose of a chest tube in this situation? Facilitate lung expansion, remove excess air or fluid from the pleural space, administer intravenous medications, monitor cardiac function. Pause the video and select your answer. The correct answer is B. Remove excess air or fluid from the pleural space. A chest tube is inserted to remove excess air or fluid from the pleural space, preventing pneumothorax or pleural effusion. The incorrect options are A, C, and D. A. While a chest tube can contribute to lung expansion by removing air or fluid, its primary purpose is drainage. C. Chest tubes are not used for the administration of intravenous medications. D. Cardiac monitoring is a separate function from chest tube placement. A client with diabetes is scheduled for a foot exam. What is the nurse's priority action during the foot examination? Assessing skin color and temperature, trimming toenails to prevent injury, applying lotion to dry skin, checking for pedal pulses. Pause the video and select your answer. The correct answer is D. In a foot examination for a client with diabetes, checking for pedal pulses is a priority to assess vascular status and circulation. The incorrect options are A. While important, checking pedal pulses takes precedence for vascular assessment. B. Trimming toenails should be done carefully, but vascular assessment is the priority. C. Moisturizing dry skin is beneficial, but it is not the primary focus during a foot examination. A client is prescribed a medication to be administered PRN. What does PRN stand for? Per rectum, as needed, by mouth, in the evening. Pause the video and select your answer. The correct answer is B. PRN stands for pro re nata, which means the medication is to be administered as needed. The incorrect options are A. This refers to medication administered through the rectum. C. This refers to oral administration. D. This refers to timing of medication administration. The nurse is caring for a client with a fever. What intervention is essential to promote comfort and reduce fever? applying cold compresses, encouraging warm baths, administering antipyretic medication, increasing room temperature. Pause the video and select your answer. The correct answer is C, administering antipyretic medication. Administering antipyretic medication such as acetaminophen or ibuprofen is a common intervention to reduce fever to promote comfort. The incorrect options are A. Cold compresses may provide temporary relief, but antipyretic medication is more effective in reducing fever. B. Warm baths may increase body temperature and are not recommended for fever reduction. D. Keeping the room temperature comfortable is important, but the antipyretic medication addresses the underlying fever. A client is receiving a continuous tube feeding. To prevent complications, the nurse should take which action? Administering the feeding at room temperature, checking gastric residual volume before each feeding, administering the feeding quickly to save time, elevating the head of the bed during feedings. Pause the video and select your answer. The correct answer is B, checking gastric residual volume before each feeding. Checking gastric residual volume before each feeding helps assess the adequacy of gastric emptying and reduces the risk of complications such as aspiration. The incorrect options are A. The temperature of the feeding is not the primary factor in preventing complications. C. Administering the feeding slowly and following recommended guidelines is important for safety. D. Elevating the head of the bed helps prevent reflux and aspiration during feedings. A client with a history of diabetes is admitted for a surgical procedure. The nurse is aware that diabetes can affect wound healing, primarily due to increased blood glucose levels, decreased blood pressure, elevated white blood cell count, reduced platelet count. Pause the video and select your answer. The correct answer is A. Elevated blood glucose levels in diabetes can impair wound healing by affecting cellular function and increasing the risk of infection. The incorrect options are B. While blood pressure can impact circulation, elevated blood glucose is more direct factor in impairing wound healing. C. Elevated white blood cell count may indicate infection, but it is not the primary factor in impaired wound healing. D. Platelet count is more related to clotting, and reduced platelets can affect hemostasis but may not be the primary factor in impaired wound healing. A nurse is preparing to administer an intramuscular injection. What is the preferred site for IM injections in adults? Deltoid muscle, vastus lateralis muscle, dorsogluteal muscle, subcutaneous tissue. Pause the video and select your answer. The correct answer is A. The deltoid muscle is a common and easily accessible site for intramuscular injections in adults. The incorrect options are B. While the vastus lateralis is a suitable site, it is often used in infants and young children. C. The dorsogluteal site has been associated with nerve and blood vessel injury, and it is not recommended as frequently as the deltoid and ventrogluteal sites. D. Subcutaneous tissue. Intramuscular injections are administered into muscle tissue, not subcutaneous tissue. Comment below and let us know how many questions you got correct. Click that subscribe button and join us next Friday.